Dengue causes, types, symptoms, prevention, and treatment. Also know about homeopathy medicines. Dengue break bone fever, dengue hemorrhagic fever DHF, and dengue shock syndrome spread through Aedes aegyepti mosquitoes mainly in tropical and subtropical countries. The female Aedes aegyepti mosquitoes feed on human blood mainly in the daytime and has habitats. Man-made uses water in a container. Dengue virus has 1, 2, 3 and 4 types. 4 closely related viruses named DEN1, DEN2, DEN3, and DEN4. If the treatment didn't start properly or in severe condition, it can cause person's death. Incubation period 3-7 days. Onset sudden attack. Temperature continues 7-8 days. Classic dengue break bone fever. Sign and symptoms: malaise and chills with rigor, coryza, headache, aching pain in eyeballs, conjunctivitis, photophobia, nausea, vomiting, anorexia, extreme backache, leg and joint pain, restless, insomnia, depression, abdominal discomfort, tongue furred, rapid pulse then slow, and temperature falls to 100 degrees Fahrenheit or low with sweats. Patients feel better, but after 24 to 72 hours fever again reappears lasting 2-3 days. Typical saddleback fever. Morbilliform rash can appear in hands and feet. It can spread to arms and thigh with itching. Pain also returns. Bradycardia, leukopenia during the second time of fever, and sometimes mild bleeding comes. Dengue hemorrhagic fever DHF and dengue shock syndrome DHF. All 4 dengue virus serotypes can cause DHF and DHF. Sign and symptoms: high body temperature, rash, red or purple blood spots in the skin, excruciate pain in the eyeball, typically pain behind the eyes, with a headache, myopia, body ache, anorexia, nausea and vomiting, epistaxis, gum bleeding, ecchymosis, spitting up blood, hematemesis, blood in the stool, melena, menorrhagia in the female, unusual bleeding, nose or gum bleed, small red spots under the skin, or unusual bruising due to plasma leakage, low blood pressure, tachycardia, heart beats faster than normal, narrow pulse pressure, sometimes pleural effusion, ascites and pericarditis. Some patient may develop complication encephalitis, liver failure, myocarditis, disseminate intravascular coagulation. The patient develops cold, clammy skin, hypotension and shock, abdominal pain. Diagnosis: leukopenia, decreased platelets count, thrombocytopenia and raised liver enzymes. Hemoconcentration: chest X-ray for pleural effusion, USG for ascites and gallbladder thicken. During prolonged shock, metabolic acidosis, hyponatremia and blood urea increased. How you may prevent it: use insect repellent. Use mosquito net. Destroy Aedes aegypti mosquitoes, adult and larvae. In broad breeding places, sprays kerosene with DDT, dicaffeine powder and bleaching. Drink sufficient water daily, about 3 to 4 liters. No proper vaccine is available and no medicine is available to treat dengue, but you can prevent it. Dengue treatment is mainly given relief from symptoms. If the treatment didn't start properly, it can cause person's death. Mosquito larvae clean from tracks and swamps. Alert to public and dwelling places for mosquitoes. Once a week, empty and scrub, turn over, cover, or throw out items that hold water, such as tiles, buckets, planters, toys, pools, bird baths, flower pots, or trash containers. Check inside and outside your home. Mosquitoes lay eggs near water. Cover all body with clothes. Wear long-sleeved shirts and long pants. Treatment for dengue. Treatment will be depending upon the conditions. Immediately visit any good general practitioner for proper checkup and follow his instructions. If you neglect it, then it can be life-threatening. Homeopathy treatment will be symptomatic. Eupatorium perfor, Arsenicum album, Gelsemium, Nux vomica, Merc, Cor, Rus toxicodendron, Bryonia, Belladonna, Rus venenata etc. are very useful. Homeopathy medicine can be very effective. Visit a doctor for proper treatment. Some doctors says papaya leaves and seeds are good for dengue treatment. Take sufficient water, if necessary saline and blood transfusion with nursing care. Regular blood platelet count should monitor. If less platelet should be given. Oxygen should be given.
Visit our website www.medihelp365.com to find doctors, hospital, medical service provider informations, read useful medical articles and lots more. Subscribe our YouTube channel Medical Help 365 Days to see medical related useful medical videos. Press bell icon to get instant notification.